Greetings, everyone, and welcome to EcoStruxure for Healthcare Expert Learning Session, where we will focus on how collaboration can create a connected and better hospital. My name is Margaret Hariman, and I am the Healthcare Segment Manager for Schneider Electric Singapore. In this panel discussion, we will discuss with our technology partners as well as customers on the future of modern hospital. What does it look like? How can we leverage on IoT and digitization? How can we create a better connected hospital with collaboration? Allow me to introduce you our panelists for this discussion. First, we have Dr. Andrew Santoso, the Chief Operating Officer from Indriati Hospital, Indonesia. Second, we have Mr. Alex Lau, the Chief Executive Director from Anacle Technology Systems, a leading software partners in Asia. Next, we have Schneider's very own building segment president, Mr. Michael Sullivan, who also covers healthcare, data centers, hotels, real estate, as well as banking and finance. And lastly, we have Mr. Wei Ting Lin, who is the Construction and Planning Director from Changgung Memorial Hospital in Taiwan. Thank you, gentlemen, for joining me this afternoon. When we talk about digital technology in healthcare, we cannot run away from artificial intelligence or AI, as well as Internet of Things or IoT. With this digitization in healthcare, apparently what we do is we are moving from a reactive kind of mode to a predictive kind of solutions. We see change in how the clinical staff actually treats patients as well, especially in the hospital facilities in their day-to-day operations. Now, with this in mind, Dr. Santoso, how do you think predictive analytics has benefited you and your team in today's operation?
Okay. In my opinion, the hospital must focus on its patient as a person in need, not rather than a source of business revenue. The context should change from the cure to care. So, to be able to make that, the hospital must be able to collect data, to collect all the supporting data to predict the development of the disease that occur in the region. So the hospital can make actively participate to change the mindset of the community towards the healthier lifestyle. The demographic data of the disease can be collected and analyzed in the hospital, so the medical team can draw conclusions and determine what the next steps that they can take to make some educative and preventive action in the community. For running the hospital, in the running of hospital, the internal management team can utilize monitoring the system. So like we do in Indriati, so as all the reports, all the analysis-based reports, we can collect them in one system, so we can prevent everything that should not be happened before, like that. Maybe.
I see. Now, Mr. Lau, in your experience as a technology partner or technology provider, what is the number one missing opportunity with hospital without predictive analytics?
So we serve across a wide spectrum of public and private hospitals in Southeast Asia and the Middle East. So one of the biggest elements, the hospitals, whether you're public or private, right, they are always strapped for resources. There's always not enough doctors, not enough nursing staff, not enough biomedical equipment, not enough ICUs. So the ability to match resources to demand, right, is the primary goal to improve patient care, which is ultimately what hospitals are about, right? To improve the level of patient care. So this ability to match resources to demand to patient care is what you cannot do without analytics, without predictive analytics. So that is the primary, I think the most important, it's almost like you're operating the blind. You cannot see what's going on, which patient needs the healthcare most. And if you do not operate in the blind, right, you operate in the blind, then there's a lot of wastage of resources. You could save someone when you have available resources, but you do not know that they're available. An example, for example, the biomedical assets in hospital. If they fail, if they miss a single maintenance cycle, if you cannot locate them, nurses and hospitals, they rush the equipment from room to room, and they will not stop and register the location of the equipment. If the equipment is goes missing, it's somewhere in the hospital, the maintenance guy comes from the company, right, from GE or from wherever comes, and couldn't locate it. One missed maintenance cycle means that the asset cannot be used for subsequent treatment. Because who will bear the liability if the defibrillator doesn't work, it's not well maintained. So that's one expensive resource down that can save a life. So this is something that it's extremely important to our customer segment.
Thank you. Mr. Sullivan, in your global view, other hospitals using predictive, and do you have any sample of other hospitals that's using predictive analytics, and what are the possible benefits with this?
Well, what we've seen is, number one, it saves lives, and number two, improves efficiency. I'll tell you a story in particular, one of the earliest ones to adopt predictive analytics on their power systems. They were the very first hospital in the world when Schneider first came out, a university hospital. And they did it with Schneider because a year before, they lost a transformer, took out a wing of their hospital, and it cost them $1 million. And the CEO of that hospital said, I don't want that to happen again, because where do we get the money to pay for this loss? So they put predictive analytics in the hospital, and not more than 2 weeks later, they found a problem. It was in their primary data center. It was showing that there was a transformer that didn't look right. And they came back with the statistics on what was happening with that, did a gas sample, and discovered that the transformer in their primary data center was about ready to explode, right? That would have taken out the hospital for a week or two, right? So we saw immediate benefit in terms of safety of patients and staff first, and secondly, preventing a loss that could have occurred without the ability to predict. So we're seeing the earliest adopters now, but we think it's going to come quickly because of the reasons of safety as well as efficiency.
Thank you, Mr. Sullivan. So if I recap on these predictive analytics topics, what I notice is that from a hospital perspective, it does help to change the mindset of the nurses as well as the clinical team from a patient, how to cure the patient, to the patient care. And in terms of the technology partners, as well as from a global perspective, it does help to save costs, save operating costs in the long term. So with that, allow me to touch on the next topic. When we go to digitization, we go to the IoT, all right? And predictive analytics relies heavily on IoT. And we can see how the interactive of the connected products to the edge control layer, and how we can use all the data that's being collected to be an actionable data. So, Dr. Santoso and Mr. Lin, in the design and operations of a hospital, what technologies do you use to ensure the uptime of patient services? Mr. Lin, perhaps you would like to start first?
First of all, I have to introduce my hospital because it's a very big medical center in Taiwan. Actually, it's the biggest in the world. We have 8 million patients a year visit. So my knowledge actually is based on this part. So every time we design the hospital, we have to take care of all the data. The data, not only the medical, but also the services. So even the parking, we have to calculate the staying period of time, so they can make every parking in an efficient ways. Otherwise, they make the traffic jam. The other database is because of the flu. So sometimes that in the hospital, the patient comes at the same time. Even the emergency, they always come at the same time. So we have to arrange the patient, doctors, nurse, and all the supporting team. They can work out together, and they all need the real-time feedback. So we put the data, we catch the data from the dormitory. We see how many nurses in the dormitory. We catch the data from the so-called doctor community. We know how many backup we have. So if there's anything happen, we can easily to let them know. But right now, before we have to use the telephone to collect every data and even the beepers to get the response. But now we have the sensor. So when how many nurses on duty and how many nurses in the resting, so we can collect the data and simultaneously feedback to the need for the future or for later. That is one part we use for the data. And also the in hospital that population always cause the infection. So if there's too many people at the same time, we try to let them know they should not come in at the same time. So when the number of the people getting some higher, so the air conditioning, everything all the system have to respond to the data. And before, manually, we put people go there and take back. But now we had all the data to count in the numbers. So we can know how many people and how many energy consumption, and then we have to synchronize through the system, so-called intelligent system. That's what we're doing now. Okay.
All right. How about Dr. Santoso?
Maybe it's a little bit different with Mr. Ling because my hospital is very, very young. It's only 1 year old. In Indonesia, we already deployed, in my hospital, already deployed hospital management system which can manage a lot of medical services like medical reports, inpatient and outpatient check-in, and about the appointment for the doctors, but it's only limited to the billing, limited to the medical services, including the billing and the finance report. One of my current agenda is I want to connect the building supporting system into our HMS, so we can adjust everything by the system. It's like kind of shooting two birds with one stone because. For example, I can adjust the room settings from the system, so it keeps patients happy and I can save energy and save the human resource. I do not need a lot of people to make changes in the field. Maybe like that.
All right. All right. So for Mr. Lau, a collaboration with Schneider Electric actually delivering the IoT solutions in data center had been done before. Do you think that we can implement a similar kind of solution in healthcare?
Yeah, no, absolutely. So we have done many projects with Schneider on visualization of energy, environmental, and process statistics within the data center. So the same kind of because data centers are mission critical. The hospital is also mission critical. You cannot have systems that fail, even when they're redundant. It must work 24/7, 365. So the same level of strict requirements and the same similar experience with the healthcare, definitely we see a bright future ahead. Yeah.
Okay, sure. So if I recap correctly in this topic is that coverage, for Dr. Santoso is the coverage on the hospital management system, where you would like to integrate more of your clinical system into, as well as your infrastructure system into one platform to help your team to operate more efficiently and more patient-centric. And for Mr. Lin also, in terms of your directions in this IoT is also more on the patient-centric. So it's like you would like to move from reacting to what is happening already, but to make it more proactive. Before it happens, you alert it to your customers. And of course, we also see that in terms of IoT solutions in healthcare, definitely is the way to go. And we do need to see more collaborations in these aspects. So as we advance into cloud-based solutions and digitized data, cybersecurity is a number one concern. So this question is actually for Mr. Lau as a tech partner. So how does Anaco take precautions and assure your customers that security will not be an issue?
Cyber security, right, is actually quite an annoying problem. It's a necessity. It's almost like, like hacking is the third oldest profession in the world. The moment you have technology, the hacker pops up, right? Recently, for all the Singaporeans here, there is a major incident in Singapore. Some hacker hacked into the national healthcare system and stole records of 500,000 patients, including the leadership.
Yep.
Yeah. So the security, right, starts from security review of what are the requirements or the level that you want to protect. Then it continues with incessant vulnerability assessment, incessant penetration tests, incessant compliance to all there's at least 30, 40 security standards that governs IoT protocols, that governs cloud technologies, that govern fog computing. After that, then you thought you have a fail-safe system. Then the guy within the organization, right, gives out his password and his two-factor authenticator. So education becomes the next step. Security awareness, cybersecurity education becomes the next step. Invariably, no matter how strong you protect your system, the human component, right, your human credentials, the human management, right, is always the weak link. So the second part that's often not as emphasized is the education of the users of the client in working within the cybersecurity framework. So that's how we do it. Both the actual system itself and the education of the actual people who operate the systems.
In your experience, Mr. Lau, as a technology partner, do you see this kind of a resistance from the end user side or any other users with regards to?
Traditionally, building systems, they never had to be exposed to the internet. Building systems are always its own private network. But with the advent of cloud computing and IoT, right, suddenly you open a previously insulated community to the wild world, where the bad guys are hiding in every corner. So definitely there's a resistance, but the resistance gets overcome as actually it is easier and easier over time. People get more and more educated. Definitely there's resistance, but it gets better over time.
Mm-hmm. Yeah. Okay, thank you. Mr. Lin, from your design perspective, as you do your initial design for a hospital, for example, how do you ensure that cybersecurity is actually built into the design? And who needs to be involved? As well as how do you ensure that whatever that you design in your initial stage is being delivered?
Actually, safety and security is two important issues for the designing or planning stage. And usually people get afraid of technology, so they use the security reason to resist. Old technology, we have the security problems. New technology, we also have the problem. I once talked to a banker, say that you put the money in the bank and say that you have the real money in there, but actually you only get the numbers. So now we get the numbers with no number. Number is only in your phone. So the security is the same. The same in what aspect? The whole system have to be secured. What should to be secure is the line, the system, and the end user terminal. Last two parts we are designing principle to make it secure. So we don't put the so-called wireless or the internet lines to somewhere invisible or not secured. And second, all the security passwords in hospital, usually we give password to our colleagues. They help us. When we type in the prescription or we type in something important, it's too urgent, so give the password. So actually, it needs secondary devices to help, like monitor, real-time monitor, or the so-called the badge. So when you touch the badge, so you can type something or you can see something. So we must find something real-time double-check things. Then we can secure that part. And the second part will be the so-called our system base. And of course, the system base have to be away from the hospital. We have double beds, one in the north of Taiwan and one is north of south. So when there's an earthquake, we can find a security and safety place to secure all the data. And the third part, they always had hackers, always. So we just depend on IT people to catch the so-called, irregular frequency to not attack, to use some terminal or to some system. And it's kind of so-called intelligence or the data collecting things. So like your way to detect if the system fail. So when there is a frequency differences, doesn't mean wrong, but it's something happening. So if we can do this through intelligent system, through a cloud, then I'll be more safer than before.
Mr. Sullivan, as you can see, the three topics of predictive analytics, IoT, and cybersecurity, they are always hand in hand. In fact, and we also notice that we cannot work alone to deliver this requirement. How do you ensure, from a global perspective, that collaboration allows hospital to use the best technology, deliver the valued information in a safe and protected way?
I think analytics is the safest, actually, from our experience, right? It's the safest because it's only going one direction out. Nothing's coming back in. It's the safest. From our experience, what's at risk is, you've used the example in Singapore, they're after patient records, ransomware to try to get money. But no one yet has attacked the infrastructure of a hospital that we're aware of anywhere. We've seen them attack utilities, oil and gas. They're going after big targets like that, but no one is going after a hospital yet. And actually, the vulnerability is what he was referring to, is when they put in their standard building management systems or other lighting systems, and they put in password, like you're saying, they get lazy, then they can be hacked. And so Schneider, if you wanted to really know this topic, if you're interested in this topic, there's a cybersecurity session tomorrow. And Schneider's hired like top cybersecurity people. And most of them are working on oil and gas and utilities. That's where the critical is, right? And so they know all the tricks from how to come up the various levels. But they're saying in buildings, these guys, they just, for fun, hacked into a university in the south of Australia and start turning the lights on, shut it off, just as a joke. Seriously, it's wide open. Someone could do it. But no one has done it to a hospital. No one has tried to harm a hospital. But if it starts to come, we have all the tools, from basic stuff, human, to all the way up to provide the protection. But analytics is the least risk on them all, because it's going one direction, it's on the cloud, and when it's on the cloud, it's secure, right? Because especially if it's AWS or something like that, they back it up every day. They do complete duplications of all the data every day. They have updates of the software every day. It's safe. It's safer than on your own servers. So that's the safest of them all. It's your open architecture that's where people have been a little bit lazy about security. That's where there's vulnerabilities, but no one's taking advantage yet.
Well, my next question is actually open to the four of you. What do you think that currently missing in terms of collaborations especially in delivering digital hospital? Any of you would like to answer that?
Money. Just kidding.
Probably I'm the one in the hospital for the engineering parts. Actually, our challenge, people try to have the smart hospital. But the smart hospital mean two ways. Usually we call hospital, we call the place for medicine. All the building called hospitals. Actually, it's both. But it's two ways. So when we apply something digital or something maybe 30 years ago, so-called information technology, it changed already. But for the information technology, it's paperless. So we only have to learn the way to key in. So later will be in the wire. but it's still real. But now we call it intelligence. Some people do the decision making for us through the cloud, through the data comparison, through something comparison, different data from different places. And it's nice. But a lot of people resistant this part. That means the doctor's status getting lower. Yeah. You know, in our hospital, that usually we have the flu, but nobody know what kind of flu is that. So two ways we know what can help for the flu, because one way they put some data to the pathology to find out the virus. The second, so easy. We put different people, different medicine. 3 days later, some people come back, some people don't come back. So you know which medicines used. Right, that's so easy. That's the data power. Only the comparison, like you say.
Yeah.
So you must have the cloud to do the comparison, not in a hospital base, but a people base or country base. That will be much more benefit for the medical world. But the problem is the human body is so different. Even we are the so-called Oriental people, Chinese, Singapore, Taiwanese, Japanese, but they sometimes react differently. And for medical world, they try to find out the 1% differences or even 0.1%. We don't miss any 0.1. So in the medical world, we need 0.999. That's difficult. So we must have a very strong system to back up the 0.999 accuracy. Then we can say this is medical. So a lot of people enjoy say that the smart hospital or invisible hospital is already there. But nobody have the trust to say I can give my life to the internet or to the cloud. But we even don't give life to them. We can depend on them as a second or third opinion. That's great already. So in the hospital, they have some idea, but the idea have to be convinced by a lot of people or by different professional people, and then that will come. And for this part, I'm not so optimistic. I think that people who born in the so-called Wi-Fi age, they accept this easily. But people like me, 50 years more, they will a lot of doubts. Yeah, that's my idea.
What about you, Mr. Sullivan? Do you have any view about that? Yeah.
I think it's coming. I think it's coming step by step. My experience is not so much on the clinical side, which you're referring to. So, and I think there you have to be very careful because you're dealing directly with lives. But I think when it comes to facilities, it can have an impact on lives, but it's more around efficiency, comfort, experience, and of course safety. So there, I think it will come sooner because, and we're seeing it coming sooner there.
Yeah. Okay. Thank you. Well, I would like to open to the floor for any questions for any of our panelists.
Hi, everybody. So what do you think will be the next disruption or disruptive technology in the healthcare segment, either in the business itself or the technology that will be applied to the segment?
I think for the healthcare, there's two parts. One is medicine, one is healthcare industry. For me, medicine is already there. They use lots of technology to find out the virus or the curing way. Last year, 2 years ago, I visited the Massachusetts hospital. The doctor told me he wanted clean electricity. I just feel shocked. What is clean? He said, I don't want any frequency wave in the electricity, in the electrical systems, because they use the electricity as a tool to cure the medicine, the body, like the radiation, like the proton therapy. That part is already technology advanced. But in the healthcare industry, people have the habit, but the old habit die hard. Old habits is the culture. People come to the hospital, they want to see the doctor. If the doctor become invisible, they are not secured. All my friends come to me and say, give me a good doctor. I say, the prescription we read is excellent already. All the data told me you are fine. But he or she just need a doctor to speak. That part is belong to the God, not belong to the technology. So that part still slow. However, with the technology support, the accuracy for the doctors will be higher and higher. Not through the genetic therapy, but through some backup. Like in our hospital, we have a so-called pharmacist will check doctor's prescription. So it's still very high rate. I think every 200 prescription, they might have one mistake. Maybe not fatal, but it happens. But with the technology, we can help to do the comparison and catch the mistake and easily. So you don't need the pharmacist to check that, but the system can check that already. So I still wonder how fast it can go, because the mindset for the people grow slowly, and also sick people, they accept new technology even slower. Yeah. So, but I will try to put them easier. Yeah.
So there are some interesting, being in Singapore, right, some interesting developments. One of the concept that the healthcare sector is trying to do is to if possible, make use of technology, IoT, edge computing, to get patients out of the hospital. So you can extend patient telemetry and patient care beyond the hospital environment. So for example, there's a 1,000 household trial that they use the monitoring of the appliance use within the household to track how the patients have been faring. So just the power meter outside the house, you monitor how they're using appliances within the household to track whether the patients have just become outpatient prematurely, how well they are faring. So these are pretty disruptive to the entire country's healthcare structure, because it cuts costs and delivers better patient care. So I think there are many programs and initiatives taken place throughout many places in the world. I'll be happy to share some after the talk.
Maybe I'm sharing as a doctor here. Technology can help the doctors provide decision support system. So like me, maybe I have a patient with typhoid fever. The WHO said that prescription should be self-reaction maybe, but in Indonesia we still use chloramphenicol. So the system can make us can give some decision support, which antibiotics you can use. But actually, if we can give one to another person and we give the chloramphenicol to another person, it will react differently. It will react differently. Some people can cure with self-reaction. Some people can cure with chloramphenicol, and it's based on, like Mr. Ling said, it's based on the genetic from the patient. We cannot determine which one you can give self-reaction, which one you can give chloramphenicol. It's kind of an art. That's the difficulties for the doctors to. We can have decision support system, but my art cannot. The system cannot change my art as a doctor. That's the difficulties. Maybe that.
But I have to say, the doctor have to survive in different way and advanced.
Thank you. Anyone else from the floor?
So thinking about the facility manager, what do you think is the number one opportunity they're missing out on to save on operating costs?
Anyone? Dr. Santoso, would you like to start?
Pardon me. Can you repeat the questions? Maybe I'm sorry. Can you repeat the questions? Pardon me.
So from a facility manager's perspective, what do you think they're missing out on? What type of solutions are they missing out on to save on operating costs?
What type of technologies that they are missing on to reduce the operating costs?
They're operating.
Yes. maintenance.
So every technology under the sun. So from what we encounter with many hospitals throughout the region, usually everybody wants, because the systems are mission critical, so the ability to optimize your maintenance budget, your ability to track your assets. So everything boils down to an effective minimize your corrective maintenance, minimize your preventive maintenance. So what are you left with? You're only left with predictive maintenance. So having accurate model, having accurate predictive analytics. If I can forecast, just by analyzing the power current, whether a partial discharge has occurred inside a transformer, I'm light years ahead, in terms of operating costs compared to the neighboring hospital. So I ultimately for the facility manager, there are many aspects, but one of the aspects definitely very important, the ability to predict. So I think the topic can be a couple hours in the offing, but this is something that I thought would be in the minds of most facility managers.
I have some idea. I don't know if that can answer your question. As an engineer in the hospital, I'm worried every night, 24 hours a day, 7 days a week, because I just afraid they fail. They must have some people back up. With a very sound system, they can predict something happening. So I don't need to deal that in the middle of night. I can deal that in the daytimes. So usually people don't think about this. They put the people in charge of the nighttime accidents or something. But we should depend on technology for this part. Like I learned from Campus One in Boston. They have one team to cover all the 300 buildings, something. So we try to have the idea in the hospital. We try to minimize the people to back up the so-called security or safety issues, then it down the cost. But however, every time we talk about the safety and security issues, people only think about the cost, and it's huge. So we always say, oh, we don't have the budget, so we skip these issues. But actually, if we apply advanced technology or we change the whole system, that will make the issue easier to solve.
Thank you.
Maybe to build on that, because what we're seeing is typical facility managers almost in any country in a hospital, right? Most often they're not coming from business school trained. They're coming from different sides. And so they come to their chief financial officer, I would like to upgrade this. And they say, do more with less, right? Always do more with less because the budget's fixed and that's it, right? And what we're seeing now with the analytics is suddenly the facility manager comes with data to the chief financial officer and said, look, I can upgrade this piece of equipment now. This piece of equipment has a 95% chance of failing within the next 18 months, okay? If you don't replace it, it will be a power outage that will cost $1 million in an emergency repair, or you could replace it now and it's going to cost you $40,000. Up to you. Here's the data, right? And what we saw is on real hospitals, some of the ones I gave an example earlier, of once the incident occurred and the analytics predicted it, after that, the facility manager knew, right? The chief financial officer is listening because they know the impact. So I think that the downtime is a big source of cost. And then after, of course, the more obvious ones, energy and efficiency of what you replace based on preventive.
All right. Can I have anyone who would like to ask one more question? One last question, perhaps? Nope. All right, then, if that's the case. Well, as you can see from the panel discussions, we see how valuable it is, the predictive analytics, IoT, as well as cybersecurity. And with IoT-enabled digital hospital architecture, we see a lot of endless possibilities, whether it's from a customer's perspective, technology partners or providers, as well as from a facility manager's perspective. We see the collaboration from the connected devices to the edge control software layer and ultimately to the apps analytics and services. Now in Schneider Electric, we continuously improve with our innovation, and this allows us to enhance our collaborations with our technology partners as well as our customers. And with EcoStruxure for healthcare, of course, our ultimate importance is we deliver the right information to the right people anytime and anywhere. So, and this is of course for us to ensure that we address the patient safety, patient satisfaction, as well as operational efficiency. With that, I would like to thank everyone for attending this panel discussion. I would like to thank our panelists, Mr. Dr. Santoso, Mr. Lau, Mr. Sullivan, as well as Mr. Lin. And don't forget to open up your event apps and do rate us for the EcoStruxure learning for healthcare. Thank you everyone for your time.